Hi, Mrs. Scarpelli. My name is Michelle. I'm going to be your nurse today. How are you doing?
Doing good. How are you?
I'm doing well. So I see here that you had an ischemic stroke about 2 weeks ago, and this is your follow-up. So we're just here to talk about how your rehab's doing, if you're taking all of your medication, and to go over pretty much your diagnosis of your stroke. Sound good?
Sounds good to me.
So an ischemic stroke, just to go over it a little bit more, I'm sure your doctor already did this, but it's when you have a blood clot that just blocks your artery or your vessels, and it blocks all of the blood flow into your brain, which is what causes the stroke. And I see here that you had TPA, which is a clot buster, which you received when you first came in to loosen everything. And the medications that you're on right now is Alteplase aspirin. And I see that you also had high blood pressure, which you didn't know about, which pretty much could have led to your stroke. So you're on an ACE inhibitor, lisinopril. So let's talk about those medications for a minute. So your Alteplase and your aspirin are your blood thinners. Are you taking those regularly?
Yes, every day.
Good. And just to go over that, that's just like a blood thinner. It's gonna prevent any clots from forming. So a big side effect with those is bleeding. So you want to make sure that you're not using a sharp razor when you shave, and use an electric razor instead. You could use a soft bristle toothbrush when you brush your teeth so that no bleeding happens in the gums. And if you play any contact sports or you're going to do anything that might cause injury, make sure you always wear protection, helmets, knee pads, anything like that. Okay?
Sounds good.
Okay. So now for your blood pressure medication, so your lisinopril is going to lower your blood pressure, and it's going to just relax those vessels so that you don't have high blood pressure. It was untreated for a while, so when I looked at your vitals, it looks like it's starting to get under control, so you want to make sure that you continue taking this, because if you stop, then the blood pressure will rise again. So even if you feel like you don't need it anymore because your blood pressure is okay, you don't want to stop taking it because then you'll get high blood pressure again. And because it's an ACE inhibitor, a huge side effect with that is headaches and a really bad cough. So if you're suffering from a cough and you want to switch your medication, we can always switch you to a similar medication, which is an ARB, and it doesn't have that cough side effect. Have you experienced any side effects with your medication so far?
So far, no.
No? Okay, that's great. So your recovery time for your stroke, it could be anywhere from 3 months to 2 years, depending on how bad your stroke was. It seems that your stroke, you were only affected on the right side with some weakness and some difficulty swallowing with speech in the beginning. But I see that you're receiving your PT, OT, and your speech therapy to help with those. And just by looking at you today and seeing you, you sound good. You seem like you're doing a lot better. Are you liking your rehab?
Yes, it's going good so far.
Yeah? Okay. So just keep up with that and never lose hope because you're doing really well and your progress is showing. So now I want to just talk to you about some lifestyle modifications. Because of your high blood pressure, you want to make sure that you're not intaking too much sodium, so you're not eating fast food or processed things that are really high in salt. Making sure you're incorporating exercise, even if you're just taking a lap around the block. I know now with your weakness you might not be able to do that, but your PT and OT definitely does exercises, and they can give you some at-home exercises that don't require you to hop on a treadmill and things like that, just to keep that in the back of your head. In terms of smoking or alcohol, do you smoke? No? Okay, that's good because smoking could also increase your blood pressure. So you want to avoid smoking. And with alcohol, just to limit that intake. Okay. So now we're going to talk about when to seek care. So you should definitely keep up with your annual visits just to make sure that everything is okay. Your blood pressure medication, just so that they can check your labs, especially because you had a stroke. Your clotting factors, they are going to want to look out for that, and always look at your blood pressure and check out your heart. And when you had the stroke, if you had any facial drooping or slurring of speech and weakness on one side, those are all signs that you could be having another stroke. So if you ever feel that or are experiencing it, if someone else experiences it, You definitely want to seek medical attention and call 911 because you could be having another stroke. For ischemic strokes, it's usually you need to get care between the moment it happens to 4.5 hours. You want to have your medical attention within that 4.5 hours to prevent brain damage and having any worsening symptoms. So I suggest that you reach out to your family and friends and you educate them about what you've learned, or if they want to come in for an appointment with you and sit in to learn about it, just so that they know what to be aware of, because that could also benefit you if something happens to you.
Sounds good.
Great. So do you have any questions for me?
No.
No? Okay, so I'll give you some pamphlets and some online resources that you can look up, just so that if you have a question, you can, revert to that, and if you need anything, you could always call us.
Sounds good. Thank you.